For my presentation, we're going to look at if affordable care organizations are challenging previous healthcare organizational structures and what effect that is having on patient experiences. So first, we'll start off with what an ACO is. An ACO is an affordable care organization, sometimes also called coordinated care. So what an ACO does is it brings groups of providers and suppliers of services like hospitals, physicians, specialists, pretty much anybody involved in the healthcare process together in a care team. And what the hope of this is through this coordinated cares, hopefully it's going to reduce medical expenses by maybe cutting out duplicated tests that one doctor already ordered, or not prescribing conflicting drugs through this coordinated care, as well as being able to improve the quality of care for the patient. ACOs came about when they were mentioned in the Affordable Care Act. The United States healthcare system was on an unsustainable route where we were spending too much money per capita and not getting the results that were in line with the amount of spending the United States was undertaking. So basically, ACOs came in because there's a need in the United States healthcare system to reduce spending and cost, as well as improve the quality to each patient. So the goal of ACOs is to reduce medical spending and improve the quality of care to patients. The way they're trying to do this is by switching from a fee-for-service model to incentive-based or pay-for-performance-based model, which basically means that the care providers won't be paid for every service that they provide, which in the fee-for-service model, that basically encouraged them to incentivize getting as many treatments, or prescribing as many treatments as possible to a patient, because the more treatments they prescribed, the more money that they made. But in an ACO, what they're trying to do is reduce that wasteful spending through this coordinated care. And the way that they're trying to incentivize that is that the care providers will receive a percentage of the money they save. So they won't be paid for prescribing treatments. They'll be paid on the basis of the money that they're saving. They will get a percentage of that money, as well as for providing a good quality care. So here's just a short little video that's just going to show the basics of how an ACO operates.
The Affordable Care Act isn't just a new way to get health insurance. It also ushers in a new approach to care. Meet the ACO. An accountable care organization is a network of doctors and hospitals that shares financial and medical responsibility for patients. The goal is to coordinate care and eliminate unnecessary spending. Medicare set these up around the country, and private insurers have too. In the health system today, patients are usually responsible for coordinating their own medical care. Someone with heart disease may see a primary care doctor, a cardiologist, and maybe even a heart surgeon. But the doctors might not talk much, so they could order repetitive tests or prescribe conflicting drugs. That isn't good for the patient, and it's expensive. It's also not the way things work in most other industries. Imagine your car won't start. Now imagine that to fix it, you had to schlep to the transmission whisperer, the battery baron, the timing belt tycoon, and the piston professional. Each would only look at their piece of the car and not think about how the parts work together. That makes no sense. Instead, you go to an auto garage, where an organized crew works together to make your car run again. An ACO brings that kind of coordination to your medical care. Your doctors, imaging specialists, surgeons, hospitals all work together and share information to figure out the best way to fix you up and keep you healthy afterwards. What's in it for the ACOs? ACOs that save Medicare money get to keep a portion of that savings if the doctors and hospitals can show they're doing a good job keeping people healthier. So, are ACOs working? Well, the jury's still out. It's unclear how much money ACOs save, and some organizations that tried to form ACOs have quit. There are also concerns that ACOs could reduce competition and lead to higher prices. Wait a minute, how is this different from an HMO? ACOs have been accused of being health maintenance organizations in disguise. Both depend a lot on a primary care doctor who coordinates care. But there are some major differences. Patients in HMOs are covered only when they see doctors that are part of the HMO. In a Medicare ACO, patients can also see doctors outside the ACO. Shouldn't we worry that an ACO can save money by cutting corners? ACOs get graded on a list of quality measures to make sure no one skimps on care people need. These measures don't yet track all aspects of care, but the goal is to give ACOs financial incentives to keep people healthy instead of just treating them once they're sick. Want to learn more? Go to the address on the screen.
Before ACOs, the United States, as I said, used the fee-for-service model. And what this did was promoted providing as many treatments as possible because it would increase the amount of money that an organization or a hospital would make. This doesn't really promote good quality care because if a patient needs to come back to the hospital, it can be seen as a win for that hospital or that organization because it's another opportunity to make more money off that patient versus if you had, say, treated him properly or correctly and had good quality care and he didn't have to come back, you'd miss out on that opportunity to make money off of him a second time or her a second time. So ACOs are different from the previous fee-for-service model because they are in line with this Affordable Care Act in a way that the United States is kind of viewing health. We're trying to shift from just treating illnesses once it happens to being able to prevent illness. And what this would do is, if you can prevent the illness, it would reduce medical spending because you wouldn't have all the medical expenses that come along with paying with these expensive procedures to treat chronic illness. So what the ACO model does is incentivizes these healthcare providers to provide more preventative care and like better quality of care to reduce these number of expensive procedures. Another way that it could do that is it could reduce the number of hospital visits that a patient may need, which would in turn reduce the medical costs as well. So ACOs are going to change the patient experience a little bit, not really too dramatically, because as we've shifted from this more preventative healthcare measures, we see more patient involvement. So what ACO is going to require is you're really going to you're going to have to educate the patient on what an ACO is, so they can provide the proper feedback that you're going to need, which leads into the next one, which is patient involvement, because their understanding and engagement in this process it'll be critical, because ACOs need their feedback to gain understanding of the quality of care so the ACO can properly and accurately report this, which helps ensure the ACO model is operating how it should, which means hopefully it's reducing medical costs and improving quality of care by trying to promote this preventative care measures, which again leads to the next one, which is this change of ideals. Before there's these chronic illnesses, before of today, we had acute illnesses which we could treat with drugs and medicine, so it wasn't really that big of a deal to have to come in to the hospital, because you come in, you get a shot of penicillin, you're fine. which eventually led to longer lives and the development of the chronic illnesses that we see today, which we have not found cures or are untreatable, which is why we see, again, the shift from treating the illness to preventing it from ever happening, or for as long as we can, which again lines up with ACOs. What ACOs are trying to do is, again, promote this more preventative care and try to reduce the number of hospital stays, reduce the number of procedures or treatments that a patient has to undergo, which would reduce medical spending, but as well hopefully improve their quality of care. So the greatest impact that ACOs are going to have is on organizational structures. And the first point is going to be on the payment, where we see them, how they receive payment, shifting from this fee-for-service to incentive-based or performance-based payment model. Not all the way there yet, still in the testing stages of ACOs, where there's not that two-sided jointly shared risk yet, so it's still in the process of transitioning all the way to it. The next one will be performance and quality evaluation, which is going to be extremely important here, because without these big benchmarks that they're going to set of performance and quality, you'll not be able to really tell if ACOs are working or not. So having organizations are going to have to set up these benchmarks or comply with these benchmarks that are going to be set up for them to meet in order to receive payment. And lastly, here I think will be a big part of ACOs is the importance of electronic medical records. It's going to be really important, because being able to accurately record data to compare with the benchmarks is going to give you that baseline on whether to penalize ACOs or if they've received the payment, if they should, how much money they should receive based on meeting those benchmarks. However, I think there's something even more important than that with electronic medical records. That's being able to share these records with everyone in an ACO or the healthcare team is going to be critical for the coordinated care. It can do things such as cut down on duplication of tests that another doctor may be already ordered, or prevent doctors from prescribing conflicting drugs, which will just really help reduce that medical spending as well as improving the quality of care. So what this slide shows is just the growth of ACOs since it had been mentioned in the Affordable Care Act. And what I think the importance of this is with this larger number of ACOs in practice, we will really get a better understanding of how they're working and how much money that they are saving, or if they're not saving, and if it's just something that we need to stop doing. But I think with the increased number of ACOs and the steady gradual incline, you can see that more and more people are believing in ACOs. And so from the results so far of the ACOs that are in practice, we have seen that they have the ability to save money and reduce medical spending. One thing to note though was, and even though the total number of dollars saved from 2013 to 2014 went up, the average saved by each hospital went down. That means the newer hospitals coming in probably aren't saving as much money as the more experienced hospitals. Which suggests the longer that these hospitals these ACOs are around, the better they're getting at coordinating their care, which can reduce these costs. So it kind of provides a positive outlook towards ACOs in that the longer they're around, maybe the more efficient, the better these organizations will get at coordinating care together. So right now with the future of ACOs, it can be hard to tell where it's going because they're still so new. They were just started in 2011, so they're still really new, and every year it seems that there's tweaks or little changes to it to try to get it to work more effectively. However, as we're getting closer to this performance testing period of it, there are going to be some more changes again, but hopefully as we get to the end of this performance testing period, that we'll get some more concrete foundation to it. But even with all these changes every year, it does seem that ACOs are going to become a mainstay on our healthcare system. You can tell that by the gradual growth from year to year, and they are continuing to save money in our healthcare. So, as I said before, the biggest effects are going to be implemented on the organizational structures. The biggest change will be that shift that we see from that fee-for-service payment model to the incentive-based or the pay-for-performance model. Hopefully, we again will get to see this more shift to that incentive-based or pay-performance model as it gets towards the end of that performance evaluation period. Also, another big shift for the organization is going to be the importance of electronic medical records and being able to share them and coordinate them with everyone in the ACO or the care team. So the effects on the patient and from an ACO are their feedback is going to be paramount in being able to measure the quality benchmark on how their healthcare was while they were in an ACO and what it was like. And it's important right now as we get towards the end of this performance period and seeing how the public is reacting to the implementation of ACOs on whether they will continue or if it will die. The biggest shift, though, I think will be for patients is not in the hospital or in the healthcare organization. It'll be in their personal life where we will see ACOs promoting these preventative healthy lifestyles to prevent these chronic illnesses, not so much where it was in the past where they didn't really try to preach these healthy preventative lifestyles because they could treat everything with drugs and medicine, and that isn't the case anymore. So the data, in conclusion, the data here is showing that there has been steady growth in ACOs since they've been implemented in 2011, and they have shown the ability to reduce cost and improve quality. However, it has always been shown that they may need to be an ACO for a longer period of time before they can really see benefits in reducing cost and improving quality. So for the future of ACOs, even though that we see that they are still changing because they are so new and they're being changed and tampered and tweaked very often, I do see them becoming a mainstay in our healthcare organizations because they have year after year grown steadily. They've shown the ability to reduce cost, improve quality, and like I was saying, it seems the more experience that these organizations are getting at operating within ACO, the more efficient they're getting at it, and the more money that they can save, and the better quality that they can provide. And then here on these last two slides are just the references that I used.